What makes oligodendroglioma different from other brain tumors? Imagine a tumor that starts from a very specific type of cell in your brain, and that cell is called an oligodendrocyte. Oligodendroglioma is a tumor that originates from these cells, which are responsible for creating the myelin sheath that insulates nerve fibers and helps signals travel smoothly in the brain. This makes it different from other brain tumors that come from different types of glial cells, like astrocytes or cells that grow into glioblastomas. One of the key features that sets oligodendrogliomas apart is their genetic makeup. They are identified by two main genetic markers. First, they often have a mutation in the isocitrate dehydrogenase gene, which is common in certain types of brain tumors. Second, they usually show a deletion of parts of chromosomes 1 and 19, called the 1p and 19q codeletion. These genetic features are very important because they help doctors distinguish oligodendrogliomas from other gliomas that lack these genetic changes. Tumors with the 1p19q codeletion tend to respond better to treatments and are associated with a more favorable outlook. Oligodendrogliomas are generally classified as either low-grade or high-grade. The low-grade kind, called grade 2, tends to grow slowly and can stay stable for many years before causing symptoms. The higher-grade form, known as grade 3 or anaplastic oligodendroglioma, grows faster and is more aggressive. This slow growth pattern is quite different from more aggressive brain tumors like glioblastomas, which grow rapidly and invade surrounding brain tissue extensively. Location also helps differentiate these tumors. Oligodendrogliomas most often appear in the white matter of the cerebral hemispheres, especially in the front part of the brain. This location influences the symptoms a person might experience and guides treatment options. Other gliomas may develop in different areas, such as the brainstem or deep within the brain, which can lead to different clinical challenges. When it comes to prognosis, patients with oligodendrogliomas generally have a better outlook than those with other types of gliomas. If the tumor has the IDH mutation and the 1p19q deletion, patients can often live many years after diagnosis. The median survival for low-grade oligodendrogliomas can be around 10 to 12 years, with many patients experiencing years of stable health. In contrast, more aggressive tumors like glioblastomas often have median survival times of only a few months. Treatment response is another important difference. Oligodendrogliomas tend to respond well to surgery, radiation, and chemotherapy. The presence of the 1p19q deletion makes the tumor more sensitive to certain chemotherapy drugs, such as procarbazine, lomustine, and vincristine. Researchers are also exploring targeted therapies that focus on the specific genetic mutations found in these tumors, which may improve treatment options in the future. In summary, oligodendroglioma is unique because it originates from oligodendrocytes, has specific genetic markers like the IDH mutation and 1p19q deletion, usually grows more slowly, and is often located in the front part of the brain. These features contribute to a generally better prognosis and a more favorable response to treatment compared to other brain tumors. If you or someone you know is facing a diagnosis, it's important to work closely with healthcare professionals who can interpret these features and develop the best personalized treatment plan.